Hi everyone, and welcome to another of my prostate cancer journey updates. Today is Thursday the 2nd of July, and I had intended actually to do one of these a bit sooner, but hey, life, okay, things got in the way. I've been really busy. But where I am, I've now had 2.5 weeks, 13 sessions of radiotherapy, 5 days a week, Monday to Friday. So yesterday was my lucky 13th radiotherapy session. So I thought this was a good time to sort of bring you up to date on where I am, because that means I'm kind of a third of the way through my radiotherapy treatment plan. So let me report on what happens, and also I've got some graphics that I'm going to insert into this video, because one of the nurses very kindly let me see one of my CT scan images. They don't normally let patients see their own insides, but this nurse very kindly said, oh, come on, it's only, we're not revealing anyone else's scans to you. It's a picture of you, so go on, come and have a look. Because I had been saying, and I think I've been saying on these videos, one of the frustrating things about this disease is that you can't see it. It's taking place, the prostate gland in there is somewhere where there's, you can't feel anything. There's no nerve endings. I'm not in any pain. The only thing I've ever felt, as I've mentioned to you, was, it took me a bit longer to have a wee. And so I've always found that a bit frustrating, because it's like I can't see my enemy. Because normally if you have, say, lung cancer or something like that, there's an x-ray, you can see, oh yes, there's the big black shadow. Whereas for this, I've just had to take their word for it. They tell me you've got prostate cancer, and we're applying zapology x-ray stuff to this part of your body, but you can't see it. So I'd mentioned this to the nurses, that, it's a bit frustrating. And this lovely nurse, I won't name her because I don't want to get into trouble, said, come into the control centre here with all the computer screens and have a look at what we are seeing. And so, as I say, I'm going to put up a slide. I could potentially, I'll talk about it now. I'm going to insert a slide now. And what you can see, what you're looking at there, is a cross section through me. I'm lying on my back, so that's my big fat belly at the top, the rounded bit, and there's the bed of the thing that you slide into the scanner underneath me. And what they've very kindly done is the thing with the yellow outline there, that's my bladder. I know, you're probably going, I don't want to see this, but that's what your bladder looks like. That's my bladder, full bladder. It's all a bit grainy anyway, right? This is, the limits of the technology. It's all a bit grainy, but that thing with the yellow outline is my bladder, and that's, I have to have a full bladder, so that's what a full bladder from end on looks like. The pink bit underneath it, that's my prostate. Wow, there it is. It's just this kind of grey splodge. And underneath that, the circular thing, that's my rectum, which you'll be glad to know is empty, because it has to be. That's the whole thing, as I think I've mentioned to you. You have to go to these appointments with a full bladder and an empty rectum. That's what the enemas are for. And the reason that you have to try and do everything at the same time every day, empty your rectum, fill your bladder, is so that when you lie down on that bed and get put in for zapping, the prostate gland is in the same position every time, because that's how they target the x-rays that go in and zap the cancer. Okay, that's why it's done like that. So they have their initial CT scan that was taken, what was it, a couple of weeks before the treatment started, and then they take a fresh CT scan every day, just before they do the x-rays. It takes, like, it's hard to say, I lose track of time when I'm in the machine, but a couple of minutes. Doesn't take very long. And they use that just to kind of check that you're in the right position before they turn on the x-rays. And secondly, that everything inside you is in the right position. Okay. So that's what I look like. And that, the thing with the kind of pink outline, that is the offending object. That is the object that is receiving the zap. Now, I'm also going to put in here a second slide, which shows me from the side. Okay. What makes this bit recognizable? You can see that my front is to the left and my rear is to the right, and it's going to be easy to spot because you can see all the bones are very clearly sort of white, very pale grey white. And that's my coccyx. That's what your coccyx looks like, your vestigial tail. Okay, so that's that on the right. And then on the left-hand side again, but this time seen kind of laterally, there's the bladder on top and the prostate and the rectum. So that's what you look like, right? And that part of your anatomy. Ugh. Anyway, that's enough of the slides. So here I am back again. Welcome back, folks, to the Loft of Upper here in Hove, where I'm going to have a little sip of coffee. So let me take you through what happens. Every day I travel, and it's only a very short journey, 5 or 10 minutes, depending on traffic, down to the clinic that's opposite Preston Park in Brighton on the London Road, the A23. And it's a very modern centre. It was built in 2016. They spent, crikey, nearly 9 million quid on the place. It's got two identical, they're actually called tomography machines. Shall I flash up a picture of a tomography machine? Yes. Here comes a picture of a tomography machine. Ta-da! And we're back again. It's a giant donut, okay, with a movable bed, movable both up and down, and also the top part is like a tray that slides you into and out of the aperture. Now, if ever you're going to be facing this yourself, nothing to fear. That aperture is really quite spacious. It's probably nearly 3 feet across, something like that. So you've got plenty of room. You don't feel claustrophobic inside. So you lie down on the bed and you're on your back. Okay, your feet have to be put into like a set of stirrups to make sure your feet are in the same position, so you can't slide up and down, to keep you in the same position. So you get in. Oh, of course, you'll have changed into your what you've been provided with by the hospital, and that consists of a set of scrubs. Okay, so you have NHS blue scrubs trousers. A set of non-slip socks, because you take your shoes off, but you keep your socks on, but you put this set of non-slip socks over the top of your socks, okay? And also you have a blue kind of plastic, quite a thick plastic sheet thing that's probably about, when it's opened up, a couple of feet, maybe a bit longer, 2 to 3 feet long, by about 18 inches wide, with a couple of grab handles at the end, because that's what you put underneath your backside. And it's all covered with kind of disposable tissue, but you put that underneath your backside, because then the two nurses, one on either side, use that to kind of position pull you, push, to get you into the right position, so you're in the same position on the bed every single time. Now, do you remember I mentioned that when I had the CT scan a couple of weeks before the treatment started, a few weeks ago now, they gave me 3 tiny tattoos, just little dots, probably about the size of the tip of that pen, okay? One either side on my pelvis and one between my navel and my willy, right down there in the groin area, because those are what they use to position you absolutely precisely they have lasers on either side and above that help to make sure that you're in exactly the same position in the bed every time. So what they do is they put you on the bed, they turn on these lasers, they're just, low light lasers, and wiggle you about, and sometimes they'll grab you and shove you a bit just to make sure that you're in exactly the right position every single time. And then they confirm that they put sort of a pen mark, it's kind of lining up where the laser is with your dots, and then they leave the room and close the door, we're talking thick door, like Fort Knox sort of door. They close the door behind them, which may be concerning, but you get used to it, right? So there they are. Now you're lying on your back on this tray bed thing. Amazing. Gosh, it's like Star Trek. And they've got cameras up on the ceiling so they can see you. And they've also got a camera, because it's open-ended. It's not closed at the end like some scanners. This machine is open at the end, so they've got a camera behind your head as well so they can see. So if at any point you panic or think, oh my God, I need to go to the toilet now, you can wave, shout at them, and they'll see you. Okay? So they leave the room. The lights go down slightly. It's quite noisy, not in an unpleasant way. I don't find it unpleasant. Kind of think of industrial air conditioning unit. Partly because that is in the room with you, because this machine, because it whizzes around at high speed, the stuff inside it generates a lot of heat. So there is, in fact, a lot of industrial kind of air conditioning going on to cool the thing down. So there's that sort of whooshy noise. So then there's kind of a beep, and the bed kind of goes gnunk, and you slide in. So the inside of the scanner, it's white and very blank, so sometimes it's hard to know, am I moving? Yes, I'm moving. So you slide into the donut, basically. And the first thing that happens for the first couple of minutes is they do a CT scan. As I just mentioned to you, they need to make sure that everything's lined up precisely, that your bladder's full enough, your rectum's empty enough, and your prostate's actually in the right position. So you go in, and there's a sort of slight change in the noise, I suppose, not a lot, still mainly that kind of air conditioning thing. And it's like, oh yes, and you have to, so I forgot, obviously for them to be able to do this stuff with the pelvis, you have to slide your trousers down. They have a sort of decency tissue to make sure that your bits aren't exposed, so your trousers are slid down to kind of halfway down your buttocks to expose your pelvis, and you have to pull your shirt up. I usually just wear a t-shirt like this. Pull your shirt up so that your t-shirt's out of the way, and your hands are kind of holding your t-shirt up here on your chest. Okay? It's fine. And it's comfortable. As I say, it's not claustrophobic. It's fine. You've got your head also in sort of a polystyrene half bucket thing to keep your head comfortable and make sure you don't move about too much. There we are. The main thing is you've got to stay still. Right? It's really important that you're comfortable, and they make sure you're comfortable. You're comfortable because you don't want to move around when you're in there, because that will spoil everything. In particular, you can move your head a bit and wiggle your fingers and stuff, but you don't want to move anything from like the waist down. Stay still. So, let's say a couple of minutes, CT scan, and then there's like a beep, and you slide out again. Okay, you slide out. No one comes into the room. The room's still as it was, because what they're doing is, at that point, they're checking the scan that they've just taken. Okay, and when they're happy that And I'm sure they have a standard set of procedures that check this, check that, check this, check that. Then there's a beep and the bed shifts to a slightly different level. I think they raise it slightly, and there's a bit of a jiggle, and then you slide in again. So you're fully into the tube, and then, I mean, the bit that's got to be inside the tube obviously is where your prostate is. So you're kind of right into the tube, and there's a bit of a beep, and then the noise does change. Again, it's not loud, really. It's not unpleasant, but you can hear the thing kind of almost winding up, and then you know, they start zapping your prostate with this thing that's whizzing round in this amazing donut thing around you. You don't feel anything. There's no pain, there's no discomfort, there's no burning. One of the things about the machine that they're using on me, this is, say, the tomography machine, is that the radiotherapy, the X-rays are applied three-dimensionally. So it's not like you've got a thing that's at a particular position and is zapping you constantly from that position where, you know, you start, is that burning? No. So that prevents that kind of potential problem of you getting kind of sunburn, that kind of thing. I suppose I might end up with a stripe going all the way around my waist, but it's, so they're attacking the cancer from all directions. Absolutely phenomenal machine. I mean, the planning and engineering that went into the construction of this thing is just mind-boggling. But it does mean that, as I say, you're just lying in this donut, and you can kind of hear this jum 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 thing as it's going around you. I actually find it not at all unpleasant. I thought I might, because one of the scans I had, I think it was one of the MRI scans I had ages ago. You might remember me saying, it was like, oh my God, Close Encounters of the Third Kind. It was incredibly loud and strange, and that was claustrophobic. You know, that was a much smaller tube. This is nothing like that. And I'm actually, I admit, I find myself drifting off. I mean, the zapping only lasts 10 minutes, something like that. 5 to 10 minutes. And I just find myself nodding off. Some people apparently don't nod off at all and are quite, but actually, I mean, particularly now I've had 13 sessions. It's like, yeah, come on. Right? Or I'll think about, oh, what jobs have I got to do when I get back? Oh yes, I promised to do someone this, and so and then you slide out, and now I anticipate, you know, as soon as, you know, there's a beep and I'm moving out, so it's all over. So all right, pull the t-shirt down, and even before the nurses come in the room, I've kind of pulled my trousers up. They then, yeah, don't jump off, right? Because it's quite surprising how high you are off the ground. Unless you're extremely tall, your feet won't touch the floor, right? If you swing off, right? So wait, stay lying down until they've lowered the bed again, right, down to its normal level, okay? And then they'll help you get off the bed, the nurses, and one of the things that can happen is just when you jump off the bed, if you're too quick, some of the kind of tissue paper roll that they've used to put underneath you can stick to your skin, and you find that you're trying to walk out of the room with a tail hanging out the back of your scrubs. So make use of their assistance to make sure that you look relatively decent before you head out again. But that's it. You know, they check, oh, you're okay. The other thing I should say, when you first go in, every day, and it does get a bit tedious, your full name, your date of birth, and the first line of your address and postcode. Just to make sure that you really are you, that you haven't snuck in your twin brother or sister or someone to take your place today whilst you go off and lie on the beach. No, they have to make sure that it really is you every single day. Okay? You would have thought that they would have come up with, like, give the patient an ID card with a barcode on or something. I don't know. But yeah, you just have to state, this is me, that's my date of birth, that's where I live, and it's exactly the same as it's been every single time. Okay? Anyway, you exit the room through the big swing door, and the first thing you're going to want to do is go for a wee. And there are toilets, certainly where I'm being treated, there are toilets right there outside the zapping room, where you will want to go and empty that bladder that you had so full already when you first lay down. And now after another 10-15 minutes or whatever you've been in there, you definitely want to go for a wee. Wash your hands thoroughly. The whole hygiene plus coronavirus, etc. And they are, I've got to say, the people in the clinic down at Preston Park are meticulous about cleanliness, cleaning surfaces, anything that's been touched, right? Anyway, you go and relieve yourself, and then you go and get changed, and you go. Once a week, they'll weigh you, because if you remember me saying, you've got to try and keep your weight as constant as you can throughout the length of the treatments. Easier said than done, because certainly before this started, I was on kind of a fitness thing. I was starting a fitness thing, partly for my own psychological thing, and partly to try and lose some weight and get fit. And it's like, oh yes, you got to moderate that, Mr. Hyde. Don't want you losing too much weight, don't want you gaining too much weight. So where am I? I'm something like 118 and a bit kilos. And I suppose, yes, you could end up being quite obsessive about, oh my God, I've got to stay mustn't lose weight, mustn't gain weight. So far, it's been all right. But then it's only been 2.5 weeks, 13 sessions. 14th session today, this afternoon. So that's what it is. As I say, the nurses, all very professional. There's a team of 5 that are in rotation at the clinic there. So most times I'm there, there's like 3 of them. There's the radiologist, chief radiologist, and a couple of nurses. Because of the coronavirus thing, they're only letting in like 1 patient at a time. They're being really kind of ultra careful. So I think there's only been once or twice I've caught a glimpse of the patient who was before me. And I'm the last one in the day. So when I go out, bye Henry, and they lock the door after me, which is interesting. So that's what the treatment's like. Now, so the treatment itself and going and doing the thing has now become it's become very routine for me. Particularly because, excuse me, because, bit of coffee, because they listened to me and gave me eventually consistent times for my appointments. So it has become very routine. I noticed for the first time the latter part, so probably around about treatment number 8 or 9, I thought, I think I'm starting to feel kind of a bit more urgency than normal about needing a wee. And, discussing it with the radiologists, absolutely, it's what we talked about. One of the things that can result from this treatment is your bladder gets irritated. And since then, I would say that's been consistent. Now, I had 1 or 2 nights where I was having to get up like 3 or 4 times during the night, which exhausting, because it breaks your sleep patterns completely. So I've had some consultation with the nurses there, and I've taken their advice about moderating my liquid intake towards bedtime. You know, if you think I normally go to, I'm kind of a night owl, but if, say, you're a normal person and you go to bed at, let's say at the latest midnight, then from 9 o'clock in the evening onwards, you should think about moderating what you're drinking, and think about, you know, if you're a coffee drinker or a tea drinker, both of those things are diuretics. They make you want to go for a wee. So maybe switch to decaf, or maybe switch to herbal teas or something like that. But also, quite apart from what you're drinking, how you drink. Stop glugging back a pint of tea or whatever, or, you know, big mugs of coffee in that kind of time frame, and change your habits so that you're sipping at it. So a mug of tea or coffee lasts longer, you know, or reduce to cups or something like that. Because basically anything you can do to help prevent you needing to get up in the middle of the night has got to be a good thing. Also, if, you know, the irritable bladder thing, the other advice was paracetamol can help. So if your normal paracetamol is like 200 ml or something like that, take a couple before you go to bed, and that can help, you know, calm down any bladder irritation. So that's the bladder. I've also have to report I've now started having some irritable bowel problems. I've probably now had probably about 3 days where I've had irritable bowel episodes. Diarrhea, and that's unpleasant and exhausting, just exhausting, particularly when, you know, if it doesn't coincide with the time when you would normally need to take your enema and, you know, empty your bowel anyway. It means, you know, you've got the diarrhea episodes and that leaves you tired, and then you've still got to make sure your bowel's empty by having an enema, you know, a couple of hours before your appointment. That's the least pleasant aspect of this. But it's not been every day yet. I mean, okay, I'm on treatment 13 of 37. So, could get worse. You know, I've been warned it could definitely get worse. That's, you know, if you remember throughout this series of things, that's kind of like, I was dreading that. I was kind of really hoping I might get away with not suffering from that. But the fact of the matter is, it's a very, very, very common side effect of this treatment. So I'm just having to deal with it. So the situation overall is, it's okay. But as I say, the treatment itself, the procedure, not a problem. And, you know, certainly once they leave me alone in the room, in the tube, I find it quite restful for, you know, quarter of an hour, 20 minutes. Like the whole thing, to give you an idea, I arrive normally in their car park at about 10 to 4, something like that. 10 to 4, 5 to 4. At 4 o'clock, I ring them from outside and say, hi, I'm here. And they say, oh, when did you finish drinking your drink? Which needs to be 40 minutes before the treatment scheduled. So my treatment's technically at 12 minutes past 4. So I generally finish drinking my drinks at like 3:30. So, yes, fine, okay. So someone will come out to get you. So probably within 5 minutes, someone comes out, opens the front door, waves at me in my car, so come on in. So I go in, I get changed. So let's say I'm in the door at, say, 4:05. I get changed. They take me in the room. They do what they do. I have a wee. I get changed. I go back outside. I'm usually back sitting in my car no later than 25 to 5. So that's pretty much precisely half an hour. Some days it's been quicker. You know, so 25 minutes to half an hour, it's all done. And then I head home. So yes, that's all fine. That bit's fine. Sometimes I find that. Oh, by the way, as a little thing, a good friend of mine, Simone, who's been through a lot of all sorts of cancer treatments, said, "Oh, sometimes these things can leave you feeling a little bit nauseous. So give yourself, make sure you've got a little treat, something gingery." She recommended something gingery. I've actually not suffered too much from nausea. I think I might have had one or two tiny kind of, ooh, do I feel a bit... But anyway, I sit in the car, and the first thing I do, before I head down, I pack a little thing with 2 ginger nut biscuits. And I've got a flask of water in the car with me, so 2 ginger nuts. So when I come out, I sit in the car, I eat 2 ginger nuts and wash them down with a bit of water, just as a treat. Whether I feel nauseous or not, it's just like, okay, another one done, well done. It's just a psychological, pat on the back, keep me going. So there we are. So then, the only other effects I've had, and it's been noticeable from time to time, is just overall fatigue. There are some days when it's like really hard to get out of bed, and there are some days like when I get back from the treatment, I just think, oh God, you know what? I just want to sit in the armchair with a cup of tea, and sometimes I nod off for a bit. So, but generally speaking, other than the occasional episodes of the bowel irritation, I don't feel unwell. Okay, I don't feel unwell, and psychologically, I'm reminding myself, hey, they're doing this to cure me. Right? This is what it is. I'm being cured. But yes, it's just sometimes the fatigue. Some days, it's quite hard to focus. So concentration, goodness knows, going through what I'm going through, there's plenty of excuse to feel distracted by all the stuff that's happening, Plus, still, hey, we're still in mostly lockdown. So, but yeah, there's just some days where, the most I can summon the energy and kind of wherewithal to do is a bit of admin, answer some emails. It's hard to be creative some days. It really is. Other days, fine. Like today, I've deliberately woken up a bit earlier. I've got some maps that I'm working on for a guy that, fascinating Spanish Civil War maps and stuff. I've got lots of book projects on, quite exciting. I'm recording an audiobook for someone, which I've now done like 5 chapters of, something like that. So I've got lots of interesting work. Just some of it is creatively quite demanding, and there are days when, as I say, I come up here, sit down in front of the Mac and open Photoshop, and my mind's just a bit of a blank, and so I'm just having to be kind to myself and try to not beat myself up and say, do you know what? Okay, have a bit of a break, go and have a lie down or 5 minutes doing something else, and then try coming back to it. And often that works, it's like, okay, I've got my head in the right place now. But that's where I am, folks. That's the treatment. So as I say, I've had 13. Today's going to be my 14th out of 37. So I'm hoping nothing's going to change drastically in the next couple of weeks. But I will keep you posted. I'll probably do another one of these. June's a solid month. I've got a calendar that I'm literally it's an old-fashioned calendar with square boxes with the dates in, and I'm literally getting a big marker pen and going big cross in it for every day that I've had a therapy session, to show my progress, which again is just a little psychological trip to make me see in some way that progress is being made. Then at the end of the 37, well, they're going to bring me in for a battery more tests to make sure that they actually got rid of the cancer. I just had a letter yesterday about a follow-up meeting over the telephone with my oncologist in the middle of August. Can't remember precisely. Anyway, there we are. I hope you found that interesting and informative. I hope you've recovered from seeing the pictures of the insides of me. But that's the reality, because a lot of people say, oh, prostate cancer. Oh, I tell you what, the other thing that's making me laugh, the number of people, whether it's just autocorrect on things, whatever, oh, good luck with your prostate cancer, Henry. As if it's lying on the floor. Yeah. I sometimes wish I was lying on the floor. Sometimes I am lying on the floor, prostrate. But yeah, it's prostate cancer. But it keeps me amused anyway. Hello everyone. I thought I'd give you an extra update. This is me recording now on Friday the 10th of July. And I've just come back from my 20th treatment, which means that I have sailed past the halfway mark. The halfway one was technically yesterday, right in the middle of the session yesterday, because the midway point, is it the median of 37 is 19. But today I've had my 20th, and it's the end of the week, and I'm quite relieved. So I thought I'd give you an extra little update since the last one I recorded a few days ago. Because it's been quite a roller coaster. I think I have explained everything. I kind of reminded you of what the process of the treatments is actually like earlier in the clip I recorded, was it last week now? The process. I just thought I'd give you a bit of an update on side effects. Because, yeah, they've become more pronounced and I'm kind of learning to deal with them. So I've now got 4, if you include the hormone emotional thing. I'm feeling fine today, actually. Feeling reasonably upbeat. But there's the hormone kind of emotions all over the place effect. Then there's the, oh yes, and this is definite now, this is irritable bowel, tummy upsets, diarrhea, basically, at unpredictable times of day or night. So let's hope that you're not too far from the lavatory. And all they can recommend for that, for the time being, is loperamide is the drug. Imodium, Diocalm, those kind of brands is what it's often sold as over the counter. So if I get an attack of diarrhea, I take them. The other thing that has happened, irritable bladder, which, as I think I mentioned, means getting up many times during the night. Coupled with that now has come along the third of those type of symptoms, which is, if you like, irritable urethra. It's basically symptoms like cystitis. So you go for a wee, there's a kind of a burning sensation, and also your willy, basically urethra, can feel irritated for minutes, hours at a time, meaning that you get the feeling that you really need a whittle, and you go for a whittle and there's nothing or very little there. And it's, that's distracting, I can tell you. So that's kind of happened since I did the last video, which is why I wanted to add this bit in, because that I was coping with the other two things, but that's like, oh, do you know what? I can live without that. So I mentioned it to the radiologist today, and he said paracetamol. So I take a 500 milligram paracetamol every 4 hours or whatever it says on the packet, and he said that should help reduce those symptoms. Of course, I think that other people who've had cystitis before, I know that I've got some female friends and my dear Annie who, if they've had cystitis, I think some people recommend cranberry juice. So we bought some cranberry juice, but I think I would need to drink gallons of it. So I'm not sure how helpful that actually is, but I'll keep at it, because if there's a kind of a non-drug way of helping relieve the symptoms. But what one has to understand is that these symptoms have been brought on not by an infection, so it's not cystitis per se, right? So it's whatever cleansing effect the cranberry, whatever's in cranberry juice might have as it passes through, won't necessarily be efficacious because it's the X-rays hitting that, hitting the pelvic area that's causing this particular irritation, not any kind of infection, no kind of urinary infection. I've not got fever or anything like that, which is something you do need to look out for. If you start feeling feverish or anything, that could be down to an actual urinary infection, and that would mean go and see your doctor. So now, I just thought I'd bring you up to date on that and reiterate that now the actual radiotherapy sessions, lying down in the tube and stuff, I'm quite enjoying it. It's like going in a flotation tank but for a very, very short space of time. It's really hard to describe to you how, when I first started having these, it seemed like, I'm in this tube forever, being zapped. And now it's like I've just started to relax properly, and the tray's sliding me out again, and that's all, folks. Get changed, go back home. So, so in terms of side effects, the most pronounced things that's happened to me in recent days is tummy upsets, the cystitis thing, the urethra inflammation, and I had quite a day. I think it was Thursday morning. Emotional side effects from the hormone therapy. A real walloper, one that to an extent that I haven't had in quite a long time. Normally in recent weeks, the hormone therapy ups and downs have been relatively short-lived. Yesterday morning was like right off. And in fact, I was feeling upset all the way through to, when I had to go for my therapy, when for some whatever reason, the distraction, I cheered up. So that's been the hardest thing to cope with. But anyway, so just wanted to bring you up to date on that. Today, I look all right. I feel all right. Now I know I'm going to try the paracetamol to help cut down on the cystitis thing. That's, reassuring in my head. So I will report again when I feel like there's been something significant, or we reach another milestone, like when I'm out of 37. How's my brain going? Maybe end of next week when I'm getting towards kind of 2/3 of the way through, 3/4 of the way through the treatment program, and let you know how things are, whether the symptoms seem to have got worse or stabilized, or even, wouldn't it be nice, improved? That would be lovely. So the humble paracetamol, the marvels of pharmaceuticals. But anyway, I also wanted to say once again, huge thank you to everyone, and there've been countless numbers. I've lost track. The number of people who've sent messages of well wishes and support and what have you. Particularly my patrons on Patreon who support me on a monthly basis, and I sent out a message this week as well saying, I'm really sorry I've been a bit quiet recently, but coping with this, as I have to admit now, has knocked me for sideways more than I hoped it would. But this is where we are, so bear with me. And they've been absolutely fantastic, absolutely incredible. Just don't worry about it, mate. We'll still be here when this is all over. And of course, the good news is the last zapping treatment, 4th of August, and it's now the 10th of July, so it's less than a month to go, 3 and a bit weeks to go. So I feel like we're on the way now. I'm closer to the end than to the beginning. And as long as the side effects don't get worse, you know, I'll be able to cope with it. I'm still managing to do work and so on, as and when I can. So thanks again for watching. And as ever, if you are a Caucasian, a white guy over 50, 55 years of age, if you're a black guy, a bit younger, 45, 50 years of age, go and get yourself checked. If the thought of, you know, if I can, you watching this can help prevent just a one of you, prevent you having to go through what I'm going through, because even if you, turns out you have got the disease, you've caught it earlier than it was caught with me, that it's less aggressive, that it's progressed less far, you know, so you haven't got to go through everything I've been through so far. That would be a joy to me. Okay, so get yourself checked for the sake of a little PSA blood test, or perhaps even a little finger up your bottom. Could save your life, could prevent you needing to go through everything I've gone through if it's caught early. All right, so thanks for watching as ever, and take care.